My name is Dr. Francisco Ruiz. I am part of ART Fertility Clinics, and today we wanted to talk about a very specific medical condition called azoospermia. We usually advise the couple to come for a fertility assessment after 1 year of trying to become pregnant. If a pregnancy hasn't happened for 1 year, it's better to start doing several tests. And for men, the first and most important test is the semen analysis. What do we check in a semen analysis? There are three most important aspects that we check in a semen analysis. One of them is the concentration or the number of the sperm. The second one is how they move. We call it progressive motility. And the third one is the shape of the sperm, the morphology. So these are basically the most important aspects in a semen sample. In the condition called azoospermia, we are not able to find any sperm in the semen sample. And there are different ways to approach this condition. The way that we approach this condition, the way that we treat it, it is related to the specific cause. We usually divide azoospermia in two big groups. One, we call it non-obstructive azoospermia, and the other group, we call it obstructive azoospermia. It basically means that if the production of the sperm is normal, in the obstructive, the sperm cannot come out. And the non-obstructive, the production of the sperm is either low or no production at all. So depending if it's obstructive or non-obstructive. And the treatment for azoospermia depends on the specific cause. It can either be obstructive azoospermia, meaning that the sperm is produced but it cannot come out, or non-obstructive azoospermia, which is related to a low production of the sperm or no production at all. If it's obstructive azoospermia, it's usually straightforward, the treatment. We are able to obtain sperm directly from the testicle through a needle, just like taking blood, or through the testicle. In the case of non-obstructive azoospermia, we can start doing a small surgery, a small incision in the testicle to collect tissue directly from the testicle. And in the embryology lab, we can look for the sperm in a microscope. If we're able to find sperm, then we can inject the sperm directly into the egg of the wife of the patient. This surgery for the testicle to collect sperm directly is called micro-TC, and we use the latest technology in our clinics, in ART Fertility Clinics. So what we use is a microscope that allows us to see specific patterns in the tissue of the testicle, where we can increase the chance or probability of finding a sperm. Once a normal embryo has been found, it can be kept frozen and transferred into the future once the couple is ready to become pregnant. As well, if we're able to find the sperm can be kept frozen and ready to be used in the future. If we are able to find the sperm after the surgery, then this sperm can be injected into the egg of the wife or the oocyte. We leave this embryo in the embryo lab to grow for a few days. The chromosomes of the embryo can be checked. We can freeze the embryo, and in the future, this embryo can be transferred into the uterus of the wife. If the sperm is adequate after the injection into the egg, this sperm can be frozen and can also be used in the future. Azoospermia is a relatively common condition, and we treat it here at our center in ART Fertility Clinic. And we have a high success rate as well. Here at ART Fertility Clinics, we have the latest technology to offer specifically for this condition of azoospermia, and we can try to help you achieve that dream of becoming a father.